standing here today really, as much as anything, as a nurse who's spent a lot of time looking after people affected by cancer and their families, but also as the sister and aunt of members of my family who've had cancer, and really wanting to try and share with you today some perhaps more informal reflections about what I think are some of the tips and wrinkles that can help people as they either start this journey or getting through it and out the other end. People often say, cancer's a word, not a sentence, but I don't think that is the experience of most people who hear those words, you have cancer, from across the table in a medical consulting room. It feels much more than that. And it often is described by people who receive this news as creating some kind of shift from before that moment to after that moment. Some people describe this as being almost like a wall going up between them and the rest of the world. People recall sitting in their car outside the doctor's surgery and really not even being able to understand or take in everything that had happened. Interestingly, cancer is one of those things that is associated largely in people's minds with negative words at that point. People think about pain, about sickness, and about all the terrible things that might happen. But interestingly, when you talk to people who've gone through a cancer experience, often at the other end, the words change, and people say that even though it's been a terrible thing for them, there's also been positive aspects of that experience. And part of what I want to really talk about today is perhaps some things that might help make the positives outweigh the negatives, and I wouldn't certainly want to underestimate the negatives. When you get told that cancer diagnosis, you are entering into unfamiliar territory, and the relationship that you will form with the doctor who is going to treat your cancer and the team that sits around that person will be the most important aspects of your experience or the experience of those close to you. Remembering that 1 in 2 of us in this room will be diagnosed with cancer before the age of 75. So even though cancer's outcomes in Australia are fantastic, we have amongst the best cancer outcomes in the world, with a 5-year survival rate of about 65% overall, and survival rates as high as 95% for early diagnosed breast and prostate cancer. So it's largely a good news story, but it is also not always a good news story. And so these relationships are going to be a lot of what I focus on today, because as people who are either having their own diagnosis, so remembering 1 in 2 of us, or by definition, the fact that we will all have somebody around us who receives this diagnosis, managing these relationships will be the most critical survival factor, I believe, and yet are probably the most difficult things to learn if the health system is not something you're familiar with. So what are some of the things that can help right at the beginning? I think it's really important that you have somebody with you during your medical appointments, particularly those early ones. And often what happens is the person you take is your closest loved one, maybe a husband or a daughter, where sometimes that actually is as painful of an experience for them as it is for the person who's getting the news, because not only are they having immediate feelings of the potential for their own loss as a carer, but also wanting to protect their loved one from pain. And some of I think the greatest things that I've seen happen for people is to have somebody with them who's perhaps not quite that close, who hears more things. Patients often report saying that after the words, you have cancer, they remember nothing else from the encounter. And yet from that moment, the most important information comes through. And if in fact you have that experience and you don't remember, make another appointment. Make sure that you go back to clarify that. I think it's important to write down the questions, have them on a piece of paper. For those of us who are not used to encounters on a regular basis with doctors and health professionals, often you can be dominated by that encounter, and if you don't write the things down, you almost certainly get out to the car after the appointment and think, oh hell, I didn't ask that. Whereas if you write them down and you've got somebody with you who can be the advocate for those questions being asked, you're much more likely to get them answered. And if you don't understand the language, we health professionals are incredibly full of jargon and words that we find normal and part of everyday language that are not normal for you. And so ask for clarification if you don't understand, and don't try not to be rushed through the encounter. I think it's also useful to reflect on the kind of role that you would like to have in your medical decision making. What sort of a patient are you going to be through this encounter? Are you the sort of person who says, whatever you say, doc, and that's all you want to hear and that's okay? Or are you the sort of person that if that's the encounter you have, who will be dismayed by it and full of regret and anger afterwards? So have some time reflecting on that. And if you're the person who doesn't like to ask questions, can you appoint somebody else who might do that and take that slightly more active part? Because there will be times when you will regret not being slightly more active if you're not. But if I take my mother's generation, being active is an anathema. She can't do that in her medical encounters, and so if one of us don't do it for her, nobody will be active. And so take some time to think about how you will get the most out of that encounter. It's also important to understand that you've got choices in what happens to you. And there is often a fairly simple pathway to cancer treatment, but often it's a complex pathway. And if only one type of treatment is offered to you, ask if there are alternatives. And for the men in the room, this is really critical in relation to prostate cancer treatment, where what you're often choosing between is different side effects of treatment and different late effects between radiotherapy and surgery. But you almost certainly see a surgeon first who often doesn't offer you the opportunity to see a radiation oncologist. And if you don't ask about those alternatives, you may actually not understand that they exist. As I've mentioned before, having a treatment team that you trust is critically important. And no matter where you are in the system, whether you've got top-level private health insurance or whether you're a fully public patient, you have the right to ask for a second opinion. And never let anyone tell you that you can't. That is your right in the system that we work in. At this point, you'll be then beginning to navigate what becomes a complex health system journey. If you're not used to the health system that we have, it is quite complex to navigate. Many people affected by cancer not only move between hospitals because of where radiotherapy facilities are and where chemotherapy facilities are, but they also move between public and private and between outpatient clinics and medical rooms, and it can be quite difficult. We don't have fancy-wancy, fully integrated electronic health records in most of Australia. WA has some of the best, but they aren't. The information that you might expect to move with you all of the time doesn't always move you, and you'll find yourself having to repeat your story quite often. So one of the things about learning to navigate the system is to write some stuff down about what's happening to you and ask for information along the way. But also remember that there are lots of people in the system that sometimes they become present to you automatically, but not always. And so knowing that there are clinical nurse specialists and care coordinators and social workers and other people within this team who can be part of this journey and help you navigate the system is really important to understand. Cancer care these days is always managed within a multidisciplinary team, and if you're being seen by a doctor who's going to treat your cancer who doesn't work in an MDT, you might want to ask questions about that. So the sorts of things that can help in navigating the system are really around asking if there are care coordinators or clinical nurse specialists who can be involved in your care, and when will that occur. These are people who've got much more time to sit down with you than the 7-minute encounter that you might have with your specialist and really can answer the questions and really help you to understand what this journey is going to be like. Ask for written information. It should be given to you automatically, but sadly it isn't always, and you are able to ask for it. You can also ring 13 11 20, that I'll come back to in a minute, and get information, general information from the Cancer Council's helpline. Try to learn the names of your treatments. This is really difficult sometimes, but writing them down can help, because if something goes wrong after hours, that's the first thing that someone's going to ask you when they pick up the phone. What treatment are you having? Because it helps the person who's triaging on the phone to navigate you to the right parts of the system to get help. And I actually advocate keeping some sort of diary, or I've said before about documenting the information, but keeping it in one place so that you've got it handy. Electronic notes, if you're an iPad user or something like that, can also be very helpful. And again, ask questions if you're unsure. The three main types of cancer treatment obviously are surgery, radiotherapy and chemotherapy, and people will, if they watch the news at all, will understand that there's now some new very high-cost biological drugs that are changing the face of some of the ways some cancers are managed. The interesting thing about these three main treatments, though, is they're not the same. Surgery is used to treat cancer, local disease largely, although it can be used to remove other tumours, but it's essentially only controlling the cancer in the space where the surgery occurs. But cancer's a tricky disease, or group of diseases. It's more than 100 different diseases with many permutations of genetic change within them, and cancer cells can move. That's one of the clever things about them, is they escape from bodily control systems that prevent cells from, a brain cell suddenly turning up on our kidney, for example. Those kinds of controls are gone, and so they can move around. And the first place they move is to the lymph nodes that are in the region of the cancer. And so radiotherapy is a sort of a regional treatment that can treat more broadly than where the surgery occurred. And then chemotherapy is the sort of treatment that can spread right around the body and treat any cells that might have escaped, or for cancers that have spread beyond the original site. So they're all slightly different. But they all have side effects, and those side effects are linked very much to where that treatment happens. So surgery, the main side effects are actually at the site of the surgery. Radiotherapy, the side effects are largely in the region where that radiotherapy happens, and any organs that might be, so if you're having radiotherapy to your breast, for example, a lot of care is taken to prevent that radiotherapy from affecting your lungs and your heart. And chemotherapy, of course, the side effects are systemic, so that's why you have things like hair loss with many of the drugs, but they go all around the body. But many of the side effects can be reduced, and this is another kind of one of those spaces where it's important to be an active participant in understanding what's the likely side effects of your treatment and what it is that you can do about it. The most important people are the nurses, and in the case of radiotherapy, the radiation therapists, who will be involved in your treatment on a daily basis when you turn up to the treatment centre, about those side effects, because they will have a lot of experience, and the experiences of many people accumulated over time in helping you to do that, to manage those side effects. Ask again for patient information to understand the treatment and its side effects and the sorts of things that you can do about it. And across the nation now, some work from an important group called EviQ, or Evidence Questions, now produce patient information that includes some self-help information about the sorts of things that you can do to keep well during treatment. You can take the prescribed medication as advised. So I remember when I first started as a cancer nurse 36 years ago, nausea and vomiting were unbelievably common and very distressing, and we had very few drugs at our side to be able to help with that. These days that's very different, and the drugs are very effective for most patients, but you have to take them. And it's amazing how many people don't want to take them on a regular basis, and what happens is that their vomiting increases, and when they start taking the drugs regularly, it reduces. And so it's important to be able to talk about those sort of things. If you're getting side effects from the medications, talk to one of the nurses, in this case the chemotherapy unit, about that. I think there's also room for doing a bit of trial and error in managing side effects from chemotherapy. Talk about what's helped other people and see whether that helps for you, and try something for a while and then maybe try something else if that doesn't work. And I'll come back to a couple of examples about that in a minute. It's also useful sometimes to record the side effects that are happening so that when you go to the clinic you can talk about those with the nurse or the doctor who's treating you, because it's important that when you go, say, back for a second course of chemotherapy and you've had terrible nausea and vomiting at the beginning of the treatment, you've kind of forgotten about it 3 weeks later, or it's not so important, but in fact there might need to be an adjustment to your drugs for that next cycle to prevent it from happening again. And so having a bit of a diary about what the pattern was of those side effects can really help the treatment team to give you better advice. The other really important thing when you're starting treatment is to make sure you've got an after-hours contact number for someone in the cancer centre, or a contact number even during the day, but some way of getting back into the system so you don't feel that you have to get a switch, then get through to somewhere else and be passed on and on and on, but having somewhere direct. And most of the bigger cancer services today do this sort of thing automatically, and many of them give you a card with their phone number on it. I think the other thing with side effects that's really important is to trust your instincts. So there are some side effects like the sepsis or the blood infections that you can get associated with both chemotherapy and radiotherapy are life-threatening. And you will get instructions about those if you're at risk of having them. But trust your instincts. If you know your body and you know what feels normal and it isn't normal, react to it. Don't sit at home and be quiet. Let someone know that something's going wrong for you. And if it feels wrong, it probably is. There's not many situations where a patient turns up or rings in and there's nothing to worry about. And sometimes you can be easily reassured, but other times people who think, actually, I'm just feeling a bit cold and not quite so well, might have the flu. You might put yourself to bed. We would say, could you get into the emergency department within the next 20 minutes, please, because we need to start antibiotics urgently. So being able to trust that something's wrong and seek advice is really important. My advice would be to have those urgent numbers and the number for the ambulance beside the phone so that you can avoid some of those last-minute panics, or if you've got a mobile phone, program them in. And seek help early because, as I've said, some things just can't wait. Probably the most commonly talked about side effect, though, which is not life-threatening but is life-draining, is fatigue. It's the commonest thing that people having cancer treatment complain about, and it's also often goes on for a very long time. And this is not like any tiredness that you've experienced before. The sort of tiredness that I might complain about isn't like this. This is the sort of tiredness that's unrelieved by sleep, and patients report that it can. Some patients have it all the time. Other people can be completely normal and then all of a sudden get this overwhelming sense of tiredness and have to go to bed. And it's really confusing for their families because they think, oh, they were fine 5 minutes ago and then all of a sudden needing to lie down. So it's the common sense thing about managing fatigue, though, is to rest more. So patients actually say that the people in their lives start to take stuff off them, that they kind of trying to insist, you need to rest. Whereas actually what the science is saying is that you need to balance rest and activity, and that when you feel able to be active, and be as active as you can without making yourself exhausted. It's kind of like an energy bank that if you don't make deposits, you can't make withdrawals. And the other thing that happens if you rest too much is that you get what's known as deconditioning. So your muscles start to be less muscular, less muscle tone, and you're less able to exercise, and then that's just a downward spiral. So keeping some sort of activity and rest balance through and after treatment is really important. As I've said, don't overdo it. And this balance, this exercise is, the evidence is starting to say that it's not just about doing some walking or getting outside and doing that kind of exercise, but that light weights can also be very useful and are more effective at maintaining some of our muscle tone. So I'm not suggesting going bench pressing 100 kilos, but actually having perhaps some light weights when you're doing a walk, or when you're sitting in a chair, if you're not feeling able to get around, you can do some arm strengthening exercises. If you really are feeling worried or concerned about doing exercise or with fatigue, talk to one of the physiotherapists linked to the Cancer Centre, because they can begin to prescribe you an exercise program that can help to build up over time. And these kinds of pieces of advice move through into survivorship as well, when fatigue is still a very common problem for people months past the end of their cancer treatment. The commonest question, though, is about diet. Patients worry about diet, family members worry about diet. Everyone wants to feed the person with cancer. The last thing they often want to do is eat. And cancer treatment can impact on your appetite, so people don't want to eat as much. It can impact on your taste, and so food enjoyment changes. The things that you used to love might not be the things you love today. Some differences in sensitivity to things like salt and sweet change, and so having to experiment with some of that is important. It is important to maintain intake of food and fluids in particular during cancer treatment, but it's important to try and get enough of the right kinds of calories. And I think often what we do when we're feeling like less appetite or not that interested in food, we tend to go for the things that are like carbohydrates and have some toast or something like that, and that can be important, particularly if you're nauseated. But the best foods are actually proteins and vitamins, and so getting those in is possibly more important, because protein helps you to keep muscle strength. And so for people who find it really difficult, is small and frequent meals are best if you can do that if your appetite's poor, but also not to forget about supplements. And 30 years ago, when we used to talk to patients about supplements, we had a couple of awful sweet milk-based supplements that everyone thought was disgusting, and you'd try and make them really cold so they tasted better, and patients still didn't want to have them. But these days, because of the fitness industry, there are billions of protein-charged, nice-tasting chocolate and other kinds of supplements out there that I would encourage you to experiment with, trying to find one that you actually like the flavour of. And it's a much easier way to get in the kinds of proteins and vitamins that you require through cancer treatment than it is to try and force yourself to eat food. So experiment with them. The other thing that happens when you're nauseated in particular and you're the cook in the family is that the smell of food can switch off your appetite. So this might be the opportunity to hand the cooking over to somebody else and stay out of the kitchen. And also cold foods cause less of that kind of experience as well. I just want to have a word on smoking because this is becoming a much more important issue for people diagnosed with cancer. Everybody thinks that the Stopping Smoking Brigade are all about preventing cancer, but that's no longer true. So 2 out of 3 people who smoke will die of a smoking-related illness. So if you've got smokers in your family, get out there and get some help with that. But smoking reduces the effectiveness of cancer treatment. There's a growing body of evidence that was published in summary form last year when the United States Surgeon General report on the impact of tobacco on human health celebrated its 50-year anniversary. And for the first time, it's got a section of recommendations around what to do about tobacco in after diagnosis of cancer. And there's growing evidence that the impact of ongoing tobacco smoking, because it changes the oxygenation of cells, reduces the impact particularly of chemotherapy and radiotherapy, and therefore reduces the effectiveness of treatment if you don't stop smoking. But it's also associated with more time in hospital and more complications during cancer treatment. So you're more likely to get pneumonia and infections and heal less well if you continue to smoke. And this is a really tricky thing, isn't it? Because you've got a person who's just had a diagnosis of cancer and suddenly you're also asking them to give up smoking. But you don't have to be perfect. You can, if you are a smoker, and my niece, this is happening for her at the moment. I was the nasty bunny who said, I think you're going to have to give up smoking now that you're about to have major surgery for cancer. And so she's using nicotine patches and she's using all the support systems, and she relapses occasionally. That's okay. That will happen. But the most important thing is that you get that smoking level right down. There's also growing evidence that continuing to smoke increases the risk of cancer coming back. Now, most of the data about this is actually in breast cancer and to a limited extent in colon cancer, but that's largely because that's where most of the research is being done. But it seems to make you more susceptible. And for the guys out there, one of the interesting things is when you think you've got one cancer that you're probably not at risk of another. So there's data that shows that men with prostate cancer who continue to smoke have a higher risk of dying of lung cancer than they do of the original prostate cancer that they've already had. So that's how critically important it is to take smoking out of your life if it's a part of it at the moment. So smoking also increases your risk of another cancer, a different kind. Obviously, one of the big things about having a cancer diagnosis is the impact of cancer and its treatment, not only on you but also on the family. And cancer is a disease of families. The emotional and other impacts are felt by all of the family. And there's no right way to react or no right way to cope, and everyone does it differently. And so there's not a set of sort of standard advice about how to manage your reactions or your emotions. But I think it's back to the idea that it's important that you have someone to talk to and someone to also ensure that there's somebody for your family to talk to. Sometimes the people who are closest to you are not the right people to provide you with the emotional support when their emotions are equally the ones that are kind of on and play in this. But it's okay if it's somebody outside of that very close environment, as long as you're not shutting off from each other. But having somebody who you can talk to about what you're experiencing and how you're feeling, the things that drive you crazy, is really important. It's also really important to take some time for living. Cancer sometimes and the treatment feels like it takes over every aspect of your life. And you need to do that individually as well as a family. And I remember a woman, I was talking to years ago in developing a video on managing chemotherapy, really talked about having to make conscious decisions about the things they were going to give up in order to find time to be able to have time alone or time with the family. And I think that's a really important thing to reflect on. What am I going to what's really important to me to keep, and what is it that I can kind of let go on the edge of my life that I might pick back up later but isn't quite so critical now. And I can remember young mothers saying that they'd lie all day on the couch and then they'd suddenly get up and get ready because the kids were coming home from school, and all the energy went into that, and that was the kind of choices that they made to try and be as normal as possible for the children. But it's also really important to seek help if your emotions overwhelm. I'm constantly surprised at how incredibly well people who are facing the most arduous cancer journeys stay well emotionally and have such positive attitude to life. But there are some people for whom it is absolutely overwhelming, and they're the people that I worry about most, because it's really easy for family and friends to support positive patients. The people who it's always a joy to be around and who seem to have a really up approach to life, it's really hard to be supporting the person for whom the journey is arduous and for whom it feels like you can't make a difference or make it, help at all. And they're the ones that if you're a family or a friend in that person's life, that my plea would be for you to go the extra mile and just try and figure out what is a way that can help support. And sometimes that might be really encouraging them to get professional help with dealing with what it is that's overwhelming them. It's also important at this time to reflect on how you've coped with stress in your life before this. It's not like a cancer diagnosis is going to change that. If you're the person who felt completely crushed and overwhelmed with depression when your mother died, that's probably going to be the sort of person you are when you get your own cancer diagnosis. And if you're the person who's kind of been resilient most of your life to the sorts of bumps and grind of daily living, that's probably the sort of person that you're going to be through a cancer diagnosis. So understanding something about how you cope, but also if it's a loved one, understanding something about how they cope, you can be a little bit more prepared for that. And really importantly, don't try and be a superhuman. The people who often come a cropper are the ones who really try and keep doing everything and recognise that some things might slip, and sometimes it will be that the bathroom doesn't get cleaned every week, or you might have to get a man in to do the lawns. But just recognise that you have to take time and give yourself time to get onto this journey that you're facing, and that no one will judge you for things not being the way they always are. This brings us back to 131120, which is the Cancer Council's support and information services. And I'm going to go into a couple of these services in a little bit more detail because I think they are the ones that really can make the biggest difference. All of the things are really important. Accommodation for regional patients and wig services for people who lose their hair are really important. But the things, in my experience, that really tip people over the edge are the ones that I'd like to talk to. So the first is just the number itself. On the end of that phone number there are cancer nurses and other health professionals who know a lot about where to get the information. They know a lot about how to talk to you in a safe way and to give you the information and advice that you need. But they also can link you up to support groups. Cancer Connect, for those of you who don't know about it, is a peer support service where people affected by cancer can be linked to somebody who's had that same cancer, and you can have a link. Often people say, I'd really like to talk to somebody else who's been through this, and the Cancer Connect service can provide that for you. Really importantly, the financial assistance and pro bono legal services that are offered through this service are, I believe, one of the best things that's happened in cancer support in a long time. I use the phrase often with people in my life who have cancer about preparing for the worst and aiming for the best. That if you can get the things that are kind of the hard things to do out of the way, then you can concentrate on getting well. And this really helps to do this. So the financial assistance and pro bono legal services are particularly for people with lower resources. There is some means testing associated with it, but this is services that can help you get a will done, to enact a medical power of attorney and a general power of attorney. For people who can't go back to work, they can support early access to superannuation. They can check all of your superannuation things to see whether you've got any of those clever little insurances that are embedded around issues like trauma and give you a bit of a lump sum to help you through. Because out-of-pocket costs and unexpected things like the gap between test costs and the Medicare rebate can really trip people up whose lives are already difficult financially if you're the only breadwinner or you're a pensioner. And this service is second to none in my view, and really takes a lot off the mind of somebody who's already worrying about the fact that they're not going to be able to go to work. So the reactions of others are something also that might surprise you. The people who you thought would be your supports might be the people who find it hardest and don't come around to your house and don't ring. And these reactions, though, you have to understand that they're not your responsibility. I can remember a friend who talked to me about she was working in a cancer centre, and when she had her diagnosis, and people walked away down corridors to avoid having to talk to her. And people commonly report those kinds of experiences. And so I think that some of the things that the 13, 11, 20 staff can help you do is to really begin to process some of those things that might happen with you. Critically, though, part of this is about the other way. It's dealing with the inquiries and the offers of help. And what I've seen over the years is that many people push people away. No, there's nothing you can do, because suddenly what's lost when you get a cancer diagnosis is that sort of reciprocity that happens in normal relationships. You come over to Fred's place for dinner on one weekend, and about a month later he comes over to your place, and there's a sense of giving and not giving. And when you get diagnosed with cancer and people want to help, suddenly it feels one way and people feel a bit put off by that. And also what you'll find is there'll be the people who don't ring, but then there'll be the people who ring every day. And you can't get away from them, and it feels like you're always on and always answering questions. So one strategy that I've seen used is to appoint a spokesperson who can provide information to others. So you can let all your friends and family know that you'll give regular updates to Susan, and Susan will take all the calls. And that's a great service that you can do for your family. Make sure that you've got an answer phone on your phone, and turn the sound down when you're having that family time that I've talked about before, or your alone time. Don't feel that because people are concerned about you that you have to answer the phone all of the time. The other thing that I've often advised people to do is to make a list of the things that will help and put it by the phone. Because if somebody says, "What can I do?" often you can say, "Oh, no, I'm fine." But in fact, remember you've got that clinic appointment that is late in the afternoon next Wednesday, and you're not going to be able to pick up the children from school, or you're going to be home too late to make dinner, and a casserole would be helpful. So you can have that list of things. And I think it's about thinking about how do you mobilise the support. Now, sometimes that's very difficult for the person who's got the cancer to do, but it can be the thing that the friends and family can do to mobilise. And I've put up there a banner that, so my niece Terry is having her surgery on Thursday, and one of her friends has done this banner for a Facebook page we've set up that I started with thinking it would be a way to communicate with our relatives in New Zealand by getting them all in on a Facebook page. But this Facebook page has now got 109 members. Everyone is feeding support to Terry through this. It's raised money to pay for some of her out-of-pocket costs. It's created a purple theme. You can see my purple nail polish. Because what Terry wants us to do as a band of solidarity on Thursday is to all wear something purple for her surgery. But the way in which that has been an experience for her is an example of mobilising support. I think of another example last year when one of our colleagues, when I was working at the Cancer Institute in New South Wales, was diagnosed with breast cancer, and she was at the time having her fourth child, and the kids were all small. And just through a group of people at work mobilising support for her, we actually filled her freezer with enough food for about a decade, I think, poor girl. But we also had a fundraising evening that's paid for her childcare for the period across her cancer treatment, and she's hoping she'll have enough left to fund some of her reconstruction. So people want to help, and my experience is that often those people get pushed away. Whereas I think if you let somebody mobilise around you, you can get an awful lot of support that will make a huge difference to your journey. A journey alone feels much harder than a journey where you feel like other people are kind of there for you. Everybody you meet will be an expert on cancer. And they will all have read about the latest cure, Icelandic moss, shark cartilage injections, to name just a few of the things that have been out there. Sharks don't get cancer, apparently. That's why shark cartilage works. But now there's new research that shows that sharks actually can get cancer. But, all of these things, and Ray Lowenthal from Tasmania has written a book about some of this as well. So being able to figure out what your response is when you get this stuff thrown at you, some people find saying thank you very much and popping it in a drawer is fine. Other people feel like they have to read everything and become completely overwhelmed by what they have to do and take from all of this and the pressure that can come. But just be prepared that is one of the things, and sometimes it's useful to have this as one of the things that your spokesperson might deal with. But everyone will have a view. Don't feel you have to react to every one of those views. Importantly, finishing treatment, so you've come through all of that journey, you've managed to get over the treatment, and now everyone acts as if it's over. Right? But finishing treatment is the beginning of a whole different part of your experience with having cancer. And I can remember going to the United States once, and when people finished chemotherapy in this particular unit, there was a bell rung and sort of like this hooray kind of celebration. And the patients actually didn't find it quite as enjoyable as the nurses on the unit. It was all a little interesting. But it is the start, not the beginning. And often people find the jargon that sits around having finished cancer treatment a little bit confronting as well. So there's a lot of language now about survivorship. I'm a cancer survivor. And some people love that and other people hate it. So don't let the language define you in terms of what that means. This is, other people think that you should put it all behind you, and in fact you aren't the same person as you were beforehand, just having a little intermission of cancer treatment, and this whole sense that you should be back to what you were before and who you were before is a false premise, but that's what some people will expect you to be. Whereas the true reality is that scars can heal and blood counts can stabilise, and years may pass, but never again will the simple act of waking up to a normal, boring day as a healthy individual be taken for granted nor go unappreciated. And this is the kind of common feeling that many people who've had cancer and come out the other end feel, but at the same time may also be experiencing late effects of treatment and ongoing health and physical and emotional problems that really do continue to move with them throughout the rest of their life. So one of the really important things about ending cancer treatment is doing some things that can be about being prepared for the sorts of late effects that might occur. Increasingly, cancer services are doing what's known as a survivorship care plan. For those who don't embrace the word survivor, the language might be a little difficult. But this is a record of your treatment. This is particularly important if you're mobile, because having a record of what happened to you that you can take to your next GP, or if you move interstate, is really important. But just generally, it's an important record to have that saves the hassle of having to repeat information. But it also should record your potential for getting late effects. So were your lungs in the field of radiotherapy, and what risk is that you might have some damage to your lungs that will need to be taken account of? What are the kinds of long-term effects that might need to be monitored in terms of heart health or bone health? That kind of thing can be recorded. And it's also should include a plan for monitoring your health. What are the sorts of things that might be important? At this point, it's also the sad thing about our current way in cancer system is that when you're on cancer treatment, often your GP gets left behind. There's a lot of us trying to do a lot of work to rectify that, but it is the reality that you have less engagement with your GP. And I think it's really important when you end cancer treatment, even if your GP's been somewhat involved, to re-engage with them and to really ensure that they are involved in your ongoing care, the better the relationship between the GP and your treatment centre, really the better it is for you to be able to get any issues managed. And have a discussion with your GP about your ongoing needs. If they're not particularly interested, only want to deal with coughs and colds, it might be time to, when you're well, to look for another GP and develop a relationship with them, and you're allowed to do that as well. And I think what's really important is going back to some of the things about now, if you weren't proactive about your health beforehand, now's a good time to start becoming proactive about your health. And healthy survivorship is the same as healthy living, really. It's about taking time to process the experience but not to be defined by it. Some people kind of find it very difficult to re-engage with people who don't have cancer, who haven't been through that journey, and become a bit defined by their cancer, and it often is something they regret a bit further down the track. So re-engage with your life and not be so defined by the cancer. And take some time to recognise the gains. What you've learnt about yourself often surprises people, how much strength they have and the skills they've got to deal with some of the things that have happened, as well as taking time to acknowledge the losses, the things that may not be a part of your life into the future as a result. Some people have lost fertility, other people have lost the ability to do some of the physically active things they might have done before. And put effort into keeping well. So I've already talked a little bit about some of things, but maintaining a healthy weight and having sufficient exercise, limiting your alcohol consumption, and stopping smoking are really important parts of cancer prevention, but also prevention of recurrence. And for women in particular, limiting alcohol consumption it's now shown that there's fairly good evidence that more than a single glass of or a single serve of alcohol a day increases our risk, and that's more so after men are lucky enough to be able to have two. I try and not drink through the week and have better quality wine on the weekend, so I have less of it and just pay a bit more for it, so I kind of have an enjoyment. But I think being able to really give some focus to those things is important. However, there is no safe level of tobacco consumption, and particularly more so even after a diagnosis. And if you're having ongoing mental health issues, coping issues, a lot of people get quite paralysed by a fear of cancer recurrence, that kind of thing, then there is help available, and seeking it early is really important. I just wanted to spend a few minutes on the idea of returning to work. And I think it's really important that return to work is seen as kind of this experience, not this, but this is what your employer expects. You're better now, aren't you? Come back. This is what you feel like. And it really can be quite a traumatic experience. And I think some of the things that can help are that you can talk to your employer about a return to work plan. Be realistic about what you can achieve and be kind to yourself. If you can return in a more graduated way, that can be very useful. Understand what your rights are, but also recognise your responsibilities, because you're also in a role that carries with it responsibilities, and if you can't do them, that's pretty tough on your employer, and you're more likely to get an understanding return to work response if there's a bit of a balance between rights and responsibilities. Get some financial advice around supporting the transition, know what you're entitled to, and consider the potential reactions of your work colleagues and be a bit prepared for them, because they will blend from the complete ignoring of what's happened to you and get back on to not wanting to give you any responsibility because you're a sick person, and the full range in between. And be prepared to try and get a regular review with your employer so that you can re-look at what's happening for you as time goes on. So the best chance to live well during and beyond cancer treatment actually, though, is to understand your personal risk of cancer in the first place and to do what you can about reducing that risk. So there's a lot that we can do that we've already talked to lower our risk and to also make sure that we are diagnosed early. So the most important thing about living well is actually having less cancer to begin with. And so engage with the bowel, cervical and breast cancer screening programs. Understand your body and seek help early. Don't put it off. The most frustrating thing for people who work in the cancer field is actually the people who come along having had 18 months of symptoms, like my brother when he died of bowel cancer. He'd had rectal bleeding for 18 months and he didn't do anything about it, not even talk to me, and I work in the game, and died as a result of that, from a cancer that's actually preventable, curable early, and we run away from it because we're frightened of what the result will be. And be aware of your own body, let it kind of speak to you and seek help early. And that's all I wanted to say. I hope there's a bit of time for questions.
Thank you, Sanchia. We've got time for questions. There should be a roving microphone down here. So, let us know if you've got a question. No? All right, I might start because I always have at least one up my sleeve. Oh, no, sorry, sir.
Yes, look, I was just wondering how much of a role do you think stress plays as a catalyst for cancer?
So all of the evidence suggests that there's not a role associated directly with being stressed and having cancer. But I think the issue is that what happens in a stressed life may. So people who have got high levels of stress tend to get less exercise, eat less well, probably don't make appointments to see their doctor because they're kind of busy. So I think there's probably some side associations that sit around that kind of experience.
Hi, I'm Annie. I'm a breast cancer survivor and I've got some lymph nodes taken out. What do you recommend for lymphedema management other than regular exercises? Do we need to go for physiotherapy or a checkup by a specialist for that?
So lymphedema is one of those interesting side effects that has probably not had the research around it that it needs. So my advice would be to make sure that you actually go to an accredited lymphedema service, and I'm sure there is one in WA. Sandy will be able to let us know, where not only are there practitioners doing things like lymph drainage and massage and giving you access to the right kinds of equipment that you need, but also will be doing research within the lymphedema environment and helping to increase our understanding.
Hi, you said the most common question was about diet, so here's one. Sugar. Is there a link between sugar and cancer?
Sugar. So that what there is a link between high caloric intake, weight, and lack of exercise in the causation of cancer. So it's not necessarily just about sugar. It's actually about what sugar does in terms of increasing the likelihood that you are overweight and therefore also exercise less.
Thank you. Thank you for your talk today. My question is related to bowel cancer, and I want to know if there's any research or stats on the recovery of the bowel itself over time. Does it take, 12 months, whatever, if it's going to be functional or as functional as it can be?
It depends a lot about where in the bowel the cancer was and how much of it you had removed.
So it was a tumour in the bowel?
Yes. So the bowel is, so in terms of the large bowel, its main function is actually to absorb water. And so if you've had a lot of it removed, then the ability of your bowel to remove that water is reduced, and so you are more likely to have diarrhoea for a long time, but there's also, in fact, WA work that was done on bowel cancer, and I'm sure that the Information Services got access to this, that really looked at some of the things that can make those symptoms worse over time. So, for example, diet soft drinks and muesli bars and low-sugar chewing gum and lollies all have sorbitol in them, and that actually is a laxative, and so if you've got bowel symptoms, those things can go away. So it's one of those situations where it's not so much the amount of time, it's the amount of bowel that was removed and where that was, and being able to probably consult a dietitian about that is important, because there are food reactions that make those symptoms worse or better. And it's often a lot of adjustment and trial and error to try and figure out what's right for the individual.
Okay, thank you.
Any other questions?
Hi, my name is Serafina Guica, and we both got the breast cancer. We have the mastectomy, but we didn't have any chemo or radiotherapy, but we have the hormonal therapy. So what is the hormonal therapy? Because you didn't mention anything today.
So breast cancer has a lot of different variants, whether or not some of the hormones are receptive or not to the hormone therapy. So the women who get more chemotherapy tend to have less hormone responsive disease. So it's quite common for people just to have hormone therapy when they have hormone responsive disease. Does that make sense? So
yeah. Okay, I just 2.5 years ago I removed my left breast, and I was on hormone therapy, and I just go for checking my bowel, and somehow through when I go through the to make that X-ray, and something in my brain says, you ask the doctor if he's doing endoscopy, because I have lots of trouble with that hormone therapy. I have acid, and I lose my hair, I all go gray, and my vision was terrible. And luckily, I asked, he done it, and I went back to a doctor, and she said, you make sure somebody is with you. And I said, how come, I'm okay. And she said, I'll be good if somebody, because first time I was by myself. Second time, and she says, how come you ask for endoscopy? I didn't write. She asked me before, and my GP went on the maternity leave, and I ring my doctor. Usually he rings me all the time because I have a regular checkup of my bowel. And I asked him, and when she went, she said letter was lost, and I ring him, and I said, do you get anything from my GP? He says, sorry, I didn't get anything. I said, never mind, 6 months' time, she's coming, I'll do it then. And when I start bleeding again, and I just think, oh, God, what's new? And when I ring her, she says, don't worry, I organize everything. And it was so quick, I couldn't have time to ask her. And I asked her just my doctor, and he says, yeah, no worries, I've done it everything, because I've been with him for 15 years. And week after, I have a stomach cancer. Now I'm just wondering, if it have anything to do with that hormone therapy, have any link? I don't know, I'm just confused.
So very unlikely. I mean, the having one cancer predisposes or increases your risk of having a second cancer, most likely just because of the way in which your body manages we all have genetic or damage to our cells every day, and as we age, our ability to heal those small pieces of damage reduces. And So they're very unlikely to be related. And yeah.
Again, it's because 20 years ago, in my right breast, I take one lump out, and now I'm going regular, every. And they find something again. In first place, I ask, what is risk I'm going to have in other one? If it's be better, you just remove a boat, and I don't need to therapy, no need to anything, and I be like sort of more.
I might let Sandy close off. I'm really happy to stay behind and answer anybody's questions if they are, but we're starting to run out of time.
Sorry to cut you off there, but there's people who are obviously got other places to be. So thank you once again. Please thank Sanchia Aranda with me. Please, if you could fill in your evaluation forms and hand them in as you go out. And our next Cancer Update series is on Monday the 19th of October, The Economics of Cancer Prevention with Professor Frank Chalupka. Feel free to look up on our website. This presentation will be up there. So thank you for attending today. And we will be here for some questions if anyone wants to come talk to us.